My presentation today at ICRISACT was based on a paper that I presented, that I published last year in Economics and Human Biology. And this paper investigated the gender gaps in diets and nutrition of children and adolescents in Andhra Pradesh and Telangana using the Young Life data. This is a dataset that follows 3,000 children in Andhra Pradesh and Telangana over time for 15 years. In this paper, I investigated if and when there are gender disparities in the quality of the diets of these children, and which are the foods that are driving these differentials. In my investigation, I found that while there are small pro-boy biases in early years, specifically at 5 and 8 years old, at 15 years this gap widened significantly, with the boys having about half of a food group increase in their dietary diversity score than girls. When I examined which foods were actually driving this variation, I found that the most protein-rich and macronutrient-rich foods were the ones that boys were having the highest chances of receiving in the previous day. And specifically, I found big differentials in protein-rich foods like legumes, roots and tubers, and eggs, and also a pro-boy gap towards increased consumption of fruits in the previous day as compared to girls. Through my research, one of the main findings was that the focus on gender is not enough per se, but it's actually interesting to look at gender in its relationship with other factors, such as, for instance, position within the household or age, as what my research has found. In my case, I found this big gap in dietary equality against adolescent girls because perhaps in adolescence, gender norms become more pronounced. And so this may be one of the big factors kind of underpinning what I found in my quantitative research. So this could be taken forward in some of the programs and studies by ICRISAT, for instance, by focusing more on these demographics, which is something that ICRISAT is already doing through the program that looks at diets of different groups, such as preschoolers, adolescent girls, and pregnant and lactating mothers. Another key finding that emerged from my work is that overall, although there are these gender gaps, overall the quality of the diets of the average Indian child at the different ages is quite low. So there is really a need for working to improve the quality of diets, and this is something that also could lead to potential partnership with the ICRISAT team that is already working towards better quality of intakes of these different cereals, but also towards the promotion of healthy dietary behavior, starting from the Angawadi platform.